Evolution of public health nursing in the Philippines. The public health nursing in the Philippines comes from the caregiving provided by women, priests, and herb doctors during the pre-colonial Philippines. In this time, women didn't have much opportunity to be formally educated in school. This trend continued during the Spanish colonial era. So here are the sequence of change where the public health nursing evolved. Pre-Spanish era. Ancient Filipinos regarded health as a harmonious relationship with the environment, both natural and supernatural. Early Filipinos were good physicians who used medical herbs. When the first Spanish explorer reached our shores, what they discovered was far more than such mysticism and superstition. The Spanish historian Miguel de Lorca reported that the natives were good physicians and had a remedy for every poison.
The religious order exerted their effort to care for the sick by building hospitals in different parts of the Philippines. The earliest hospital were Hospital Real de Manila in 1577. It was established mainly to care for the Spanish king's soldier but also admitted Spanish civilians, founded by Gov. Francisco de Sade. In 1577, Bro Juan Clemente, a Franciscan friar, started public health service through dispensary in Intramuros for the indigent Dominican father. Juan de Peguero started water sanitation in San Juan, Manila. San Lazaro Hospital in 1578, founded by Brother Juan Clemente and was administered for many years by the hospitaliers of San Juan de Dios, built exclusively for patients with leprosy. Hospital Indios in 1586, established by the Franciscan Order, service was in general supported by alms and contributions from charitable persons. Hospital de Aguas Santas, 1590, established in Laguna near a medicinal spring founded by Brother J. Bautista of Franciscan Order. San Juan de Dios Hospital in 1596, founded by the Brotherhood of Misericordia and administered by the Hospitaliers of San Juan de Dios. Supported was delivered from the alms and rent, rendered general health service to the public. 1690, Dr. Francisco de Balmes introduced smallpox vaccination. 1805, first medicos titular were appointed by the Spanish government course. The medicos titulares work as a provincial health officers. A two-year course consisting of fundamental medical subject was first offered in the University of Santo Tomas. Graduates of course known as cirujanos ministrantes serve as male nurse and sanitation inspectors. 1901, the United States Philippine Commission through Act 157 created a Board of Health of the Philippine Island with a Commissioner of Public Health as its chief executive officer. The Board of Health eventually evolved into what is now Department of Health. 1905, the Asociación Feminista Filipina founded La Gota de Leche, the first center dedicated to the service of mothers and children. In 1915, the Philippines General Hospital began to extend public health nursing services in the home of patient by organizing a unit called Social and Home Care Service with 2 staff nurses. In 1916 to 1918, Perlita Clark took charge of public health nursing work. In 1919, public health nursing inaugurated its pioneer work in Tondo, Manila, when a visiting nurse, Balbina Basa, was assigned to make a house-to-house visit, health clinic, and dispensary work with special emphasis maternal and child care. 1923, 90 public health nurses assigned in different provinces. 1928, first conventions of nurses was held followed by annual conventions until the advent of World War II. 1935, 133 positions of public health nurses assigned in the community with high infant mortality.
Public health nursing during the Japanese regime, so 1941 up to 1945. The public health nursing services was interrupted because of the World War II. December 8, 1941, when the Japanese invaded the Philippine Islands. So 1941, when World War II broke out, public health nurses in Manila were assigned to devastated areas to attend to the sick and wounded. So in the next year, 1942, the training and practice of the hospital schools of nursing in Manila was violently disrupted. The group of public health nurses with physicians and administrators of Manila Health Department went to Tarlac to cure sick prisoners of war that released by the Japanese army. So now let's go to the era of the Republic of the Philippines, so 1946 up to present. 1946, post-war records of Bureau of Health showed that there were 308 public health nurses and 38 supervisors compared to the pre-war 556 public health nurses and 38 supervisors. In the year 1947, Executive Order No. 94 reorganized government offices and created the Division of Nursing under the Office of the Secretary of Health. And during the year of 1948, the first training center of the Bureau of Health was organized in cooperation with the Pasay City Health Department. In the year 1953, Philippine Congress approved Republic Act No. 1082 or the Rural Health Law. It created the first 81 rural health units. Each unit had a physician, a public health nurse, midwife, a sanitary inspector, and a clerk driver. And in the year of 1957, Republic Act 1891 was approved, amending the sections 2, 3, 4, 7, and 8 of RA 1082. It is stated as strengthening health and dental service in the rural areas and providing funds. This was resulted in additional number of positions for health workers, including the public health nurses and midwives. And in the year 1960, Dr. Francisco Q. Duque led to the first National Health Insurance Plan presented to Congress. It would extend adequate medical healthcare services to the needy at no cost. In the year 1963, Republic Act 3720 or Food, Drug, and Cosmetic Acts was established. This ensures the safety, purity, and quality of food, drugs, and cosmetics in the country. And in the year of 1967, in the Bureau of Disease Control, Mrs. Zenaida Panlilinisip was appointed as nursing program supervisor and served as consultant on the nursing aspects of 5 special diseases. It includes the tuberculosis, leprosy, venereal disease, cancer, filariasis, and mental health. And during the year of 1969, one of the definitive moments of the decade was the passage of a landmark bill with the aim to provide healthcare for Filipinos, the Philippine Medical Care Act of 1969, also known as the Medicare.
During 1975, the roles of the public health nurse and the midwife were expanded. 2,000 midwives were recruited and trained to serve in the rural areas. 3 neighboring specialty hospitals, the Lung Center of the Philippines, Philippine Heart Center, and National Kidney Institute were established in Quezon City. These 3 were fondly known as the Bopis Triangle. And a specialty medical facility for children was built, the Philippine Children's Medical Center, or also known as PCMC. During 1979, through an executive order has made, the Executive Order No. 851, or reorganizing the Ministry of Health, integrating the component of healthcare delivery into its operation and for other purposes. And Executive Order No. 119, or reorganized the Department of Health and created several offices and services within the Department of Health. And lastly, the Executive Order 51, or commonly referred to as the Milk Code. It emphasizes the superiority of the breast milk in the providing complete nutritional needs of children in their early years. During 1986, involvement of the nurses in the following program has emerged: the expanded program on immunization, control of diarrheal disease, and control of acute respiratory infections. During 1987 to 1989, the Republic Act No. 7160 or the Local Government Code of 1991 ushered in the devolution of the service and effectively transferred the management and implementation of public services to local government units. And during 1990 to 1992, Magna Carta for Public Health Workers, or also called RA 7005, was passed providing for the benefits of health workers. Insufficient funds, however, kept it from being fully implemented. During 1991, Dr. Juan Flavio epitomized the eagerness of his "Let's Do It" slogan. His catchphrase, "Let's do it," captured the infectious vitality that this barrier doctor brought to the department. And Secretary Flavio initiated various health programs such as Alis Disease, Contra Cholera, Stop Death, Araw ng Sangkap Pinoy, and Family Planning Program. And during 1992, Doctor to the Barrios Program, or DP, launched as to call for doctors to serve in municipalities identified as doctorless. And during 1993, Dr. Tan created the National Voluntary Blood Services Unit pursuant to the National Blood Services Act of 1994. And during 1995, Republic Act 710, or the Organ Donation Act of 1991, was amended by RA 7885, otherwise known as an Act to Advance Corneal Transplantation in the Philippines, and Republic Act 7875, or National Health Insurance Act of 1995. The law was a significant step forward from the existing Medicare. And the passage of the National Health Insurance Act of 1995 was a turning point in history of the Philippines public health care. During 2005 to 2007, the development of the rationalization plan to streamline bureaucracy further was stated and is in the last stages of finalization.